Hi, this is going to be my extra credit for the parental route medication. So first I'm just going to do a room scan. I'll put this in the medication drawer. Then I got my MAR, all that stuff, my mannequins, and my lab values. So first I'm just going to look at my lab values, and we're going to be doing Toradol. So we'd want to check liver and kidney values. And since liver values are not on there, we look at the bun. It's at 15 as of yesterday. Normal range is 8 to 20, so it's good to give. Now I am going to show the 3 routes of how you can give the medication. So first is going to be on the deltoid. So 3 fingers below the acromial process and be in the deltoid muscle. On the leg, it's going to be on below the ventral lateralis greater trochanter and above the femoral lateral condyle. And then for the site we're going to be giving, we're going to go on the greater trochanter, lateralis greater trochanter, fingers going towards the iliac spine, iliac crest, and it's going to be between my fingers that make a V. Okay, so now that I've done that, I'm just going to make sure that there's an active order for the Toradol. And there is. So I'm going to go into the patient's room and just ask a couple questions using my pager. Hi, I'm Leola. I'm going to be your student nurse today. I'm just going to do hand hygiene and provide for privacy. Can you give me your name and your date of birth? Okay, and do you have any allergies? Okay, looking at the provider's orders, it looks like we're going to be doing an intramuscular injection for Toradol. Does that sound okay with you? Okay, and are you okay with having the injection? Perfect. Do you have a certain side you'd like it to be on? Okay, and then are you having any pain right now? Okay, and would you rate that on a scale of 0 to 10? A 7? Okay, so that's severe pain or moderate to severe pain, which is what we give the medication for. And then are you using anything like alcohol, aspirin? Okay, since you're not using that, it's good, but we want to make sure that you don't use it while taking this medication as it can cause adverse reactions. Now that I've done that, I'm going to go draw up the medication. I'm doing hand hygiene again, making sure the 5 checks of safety, and I would leave the room. Now I am going to start doing the medication by looking at the provider order and the MAR. So for the MAR, for Joseph Smith, 30 milligrams IM, 30 milligrams IM, every 6 hours PRN, every 6 hours PRN. For moderate to severe pain, it's active, not been given yet, so it is good to give. Now, putting the provider order away, I'm going to get out my medications and my needles. So I have this safety needle. The package is intact, not expired, and it is the right size for my patient. Filter needle, right size for my patient. Package, I'm going to say, is intact and it is not expired. Now that I have checked my needles, now I'm going to move on to the actual medication, which is the Toradol. This is not actually Toradol, but I'm going to pretend that it is, so I'm going to be going off the lab values of what the MAR says. So it's for Joseph Smith. 30 milligrams IM every 6 hours for moderate to severe pain. 30 milligrams IM for Joseph Smith. It has not been given yet, so it's the right time. It's the right dose, as it's 30 milligrams per 1 milliliter. And the package is intact and it is not expired. I'd also make sure if this was a multi-dose container that I would check the date of whoever had it last, along with initials and the time, to make sure that it's not expired and it's still okay to give. And I would also do the same if I was opening it and using it. I would write my name and initials and the time and date that I did it to make sure that other people know that it's okay to give. Now my second check, so Joseph Smith, 30 milligrams IM, 30 milligrams or IM, has not been given yet. It is not expired and the package is intact, so it is okay to give. Now that I've done my second check, I'm going to bring my MAR, my needles, my 1 pager, and I'm going to bring it all into the patient's room. And I'm also going to grab a paper towel. Okay. And 2 alcohol swabs. Okay. student nurse again today. Gather all of my supplies. Could you give me your name and your date of birth? All right, and do you have any allergies? All right, so this is Joseph Smith, and he has an allergy to sulfite and betadine. I'll repeat that back. I'm just gonna scan your wristband and scan the medication with the correct dosage. So I got all your stuff for the injection. Before I start drawing it up and doing the third check, I'm just gonna educate you a little about the medication. So this is going to inhibit prostaglandin synthesis, or in other words, it's just going to decrease your pain. Can you repeat that back? Perfect. And it's for your moderate to severe pain. And then some side effects are drowsiness and nausea. Can you repeat that back? Perfect. And then, like I said earlier, on this medication, just avoid alcohol and aspirin and things like that. Okay. Now, I do not have gloves with me. Okay, now that I have gloves, just in case any blood comes out, I'm going to do my third check. So, Joseph Smith, 30 milligrams per milliliter, 30 milligrams, IM, not been given yet, not expired, packet is intact. And like I said, I would date initial and time this if I was actually using it. So first, I am going to swab the top of the vial for 30 seconds. I'm going to say 30 seconds has gone by. I'm going to let it dry for 30 seconds. Next, I am going to, now that I did the third check, I'm just going to get this on top of this, make a little more room. I am going to start getting my medication. So with keeping the syringe or the needle inside this container, I'm just going to screw off the lid. Okay. I put this on in the wrong way, so I'm just going to put that back. Without touching that, I would screw on the filter needle and loosen the cap, or take off the cap, I should say. Leave it in the container. So since it's 1 milliliter for 30 milligrams, which is what we need, we're going to draw up 30 milligrams or 1 milliliter of air. So the top black part is on the 1 milliliter. Next, I am going to make sure the valve is up. You want to put it in my medication, inject the air, turn it upside down, draw out 1 milliliter of medication. Now I'll just show this to the camera as well. It's 1 milliliter. There's some air bubbles. And with insulin, since it's a high risk medication, I would make sure to get another nurse to check to make sure it's the right dosage. Next, using the 1 scoop method, I'm going to swoop the cap back on. I'm also going to put this hand sanitizer over here, so when I'm doing the 1 scoop method later, I have something to go against. So now that I did that, I'm going to take the filter needle off, dispose of it properly, put on the actual needle that we need, loosen the cap a little, okay. Okay, now with an alcohol swab, I'm going to find the location of the injection site. I'm going to have them go on their side. They said their left thigh, which is what I'm going to be doing. Greater trochanter, fingers pointing in the iliac crest, iliac spine. Point between those 2 fingers, clean for 30 seconds. I'm going to say 30 seconds has gone by. Let it dry for 30 seconds. Once again, 30 seconds has gone by. Now, since this is an IM injection, I'm going to do a 90-degree angle. So, inject slowly. I would, on the table, pop the safety on it. And then I put a gauze and Band-Aid on the patient if they were bleeding. Next, I'm going to do the 1 cat method. And I wouldn't do the 1 cat method. For this, I would do the safety thing again, but since I'm just doing this for an example, I put the cap back on. With the 1 swoop method, like we did before, I would dispose properly of all my needles. And I put this away properly with my, if it was multi-dose, once again, label it. And then that is the end of the procedure. I also forgot to mention that when I would be doing the injection, I'd hold the skin taut and let it go to do the Z-Track method. I would stay with the patient for about 15 minutes to make sure they weren't experiencing any adverse reaction, and then check on them periodically after that. Is there anything else I can do for you? I have time. Okay, and I already would have all of this disposed and put away. So I would do my 5 safety checks: bed locked, call light, no risk of falls, bedside tables at bedside, call light, side rails aren't placed. And I would do hand hygiene. Bed moments are before and after touching the patient, before coming into contact with bodily fluids, or after coming into contact with bodily fluids, before an aseptic procedure, and after touching the patient's surroundings. And I would have already had this put away, and you just ring if you need me. I would chart in OneNote and let the provider know if there are any abnormalities.